Well, what inspired me or what led me, I would say, are somewhat different. I was a college tennis player and I had three roommates, all with bulimia nervosa. And I never knew anything about eating disorders. And I would actually fall asleep at night to them purging. And that was my exposure, my first introduction to what an eating disorder is, especially when one of them started to share her quote unquote her secret with me. Fast forward later, I worked at Cedars-Sinai Medical Center. I was in cardiology and then in gastroenterology for the first 5 years of my career. And I remember the chief clinical dietitian had asked the other floor dietitians who was interested in seeing this patient that had an eating disorder. So I always like to say that I learned about eating disorders backwards because back at that time, I did not know how to counsel clients. We're not trained doing that as clinicians starting out. So I actually, like any entry level dietitian, we know a lot about what's called enteral and parenteral nutrition, tube feedings and TPN and all this kind of stuff. And this specific patient was on a tube feeding tied down with restraints. I feel like that's very archaic. I mean, we're going back 27 years, so a long time. And that was my first exposure and introduction to someone at that acuteness and was regularly in the medical center. And I thought, looking back down the road here years later, I was like, this was not an appropriate place for this patient to be. And this is, of course, where her primary doctor was. And I'm assuming he did not know about residential or medical stabilization treatment programs. But I thought, you know what? I want to be able to learn how to help these patients and be able to make a difference in their lives and not realizing, like most dietitians, I mean, anyone that walks into our door, if they are quote unquote seeking weight loss or they're wanting to feel better in their body, chances are they may have a difficult relationship with food. It's not always about being misinformed about the nutrition sources. So I thought it would be necessary to just kind of immerse myself